traditionally, many opioids were used to kind of help with that. And unfortunately, today we know that opioids are quite risky type of medication to use. It's not necessarily the first option or a very good option. And that's really kind of where I think pain management is, well, what do you do now? You know, you go back to like early 1990s and opioids were freely given. It was felt back then that it was a reasonable therapy. Okay, you solve everything with opioids. It's not that difficult. But I think now when you know that's not the right thing to do, but these people still have pain, and that medication class certainly does work in the short run, well, what do you do now? You know, it brings up a lot of ethical questions. Are you really helping them? Are you not helping them by giving it to them or not giving it to them? And pain management is one of those professions that really brings in a very difficult set of factors, that the medication that clearly works the best is clearly the most dangerous, that not all the interventions that we do always work, and that these people, these patients will continue to age and the spine or the joints will continue to get worse. And then you bring in a psychological factor, well, as there is chronic pain, does that result to chronic depression? And that creates a whole other difficulty in trying to manage all these things over a lifetime, essentially. If you do cardiology, and essentially you're treating heart disease, it's a very objective thing. You have high blood pressure, or you have a problem with the heart arrhythmia. It's a very objective. You can treat that, and most of these things are not a painful scenario, not a debilitating scenario. So you can treat these things. The medication in class you use is not super risky to use. They don't produce significant amount of addiction and tolerance. So it's very cut and dry. Whereas pain management is clearly very gray. And how do you handle that? You always live in a gray area. How do you handle that? You know, because you don't live in their body. You don't know how they feel. The gray area of pain management is something that I think is very unique to pain management. Coming from anesthesia, it's very objective. You know, you got the monitor, you got the blood pressure, and this is what you're going to do. And then you go to pain management where there really is no objective way to measure it. But I've grown up around, and it's something I'm very comfortable doing.